Millions of Americans are trapped in the healthcare law coverage gap. Now, we've talked about this before on the show. If you go back and look to some of the interviews that we had during the Families USA conference, we had a really, really in-depth discussion about the gap that is there where millions of Americans are trapped not getting coverage. I want to talk about it again because it's such a huge problem that I thought I would address it. So let's just break this down for you, right? So all across the country, and there's some names, you got to connect faces to this, right? Like Ernest Maiden, who was dumbfounded to learn that he had fallen through the cracks of the healthcare law because in a typical week he earns about $200 from the happiness and hair beauty salon and barbershop. Like millions of other Americans caught in this mismatched state and federal rules, the 57-year-old hairstylist doesn't make enough money to qualify for federal subsidy to buy health insurance, but earns more than you need to get free health care whatsoever. And this is why. Because in the state of Alabama, the state decided not to take on Medicaid expansion. So because of that, what the federal government set out clear guidelines. They said at X number of, if you make X number of dollars or above, you get a subsidy, and there's sort of a ceiling floor combination there. You see right here, my glasses fit in there, right? And then if you fall in this little gray area between the floor of what it requires for you to get a subsidy and the poverty line, which anybody below the poverty line already gets Medicare, those numbers are filled in by Medicaid expansion. So the federal government does not give you a subsidy for healthcare because what would happen initially is you would go onto the Medicaid rolls. But because the state of Alabama, just like Virginia, just like Florida, just like many other states have decided not to expand Medicaid coverage to those individuals, they are caught in the gap. They do not get federal subsidy. And because the state didn't expand Medicaid, they really get no healthcare whatsoever. This is what you call the healthcare law in Republican government, in Republican-ran states. I qualify that a lot because it's very important that we qualify that. Because only in Republican states where they've chosen not to expand Medicaid are these individuals like Mr. Maiden uninsured, uncovered. A lot of them are the least of these. This hairstylist has diabetes. He's diabetic. And he cannot get the coverage he needs because Republican governors are playing politics with our healthcare, America. Sad, crying shame.